Good evening, good afternoon, and good morning. This is the 2131st day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. RAXITKUMAR RAMAVAT. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic doctors, students, and homeopathy lovers, and we have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. From 8:30 to 9:30, we have the international session in English, and from 9:30 to 10:30, we have a local language session in Malayalam. We have so far uploaded 2,000, 8,000, sorry, we have so far uploaded 3,800 videos on YouTube, and those who want to watch it, you can visit IFPH Homeopathy at YouTube, and you can share it to anyone who loves homeopathy. So, what are we? And today, let me come to today's guest. Today, our guest is Dr. RAXITKUMAR Ramavat. Dr. Raxit has completed MD in homeopathy and doing PhD now. And he is working as the Assistant Professor, Department of Homeopathic Materia Medica, Rajkot Homeopathic Medical College, Pearl University, Gujarat. And he is the Chief Consultant at Dr. Ramavat's Clinic and Research Center, Gujarat. And he is the owner of the Homeo Ocean, Homeopathy Pharmacy, founder of Homeopathy Ocean at YouTube channel. So such a wonderful person is here tonight, and we'll be talking about a very, very important subject, that is Ebola virus and homeopathy. Some 2 weeks back, we have a session from Dr. Deepthi, a research officer of the same subject. So we can see what Dr. Ram has to say. Welcome, doctor. Can you hear me, doctor?
Yes, sir.
Yes, you can begin the session.
Yes, sir. We can begin.
Sound is a little bit slow.
Yes, sir. We can begin the session.
Can you increase the volume a little more?
Yes, sir. Now it is audible.
Yes. Now it is a little.
Yes, sir. So first of all, thank you so much to give me the opportunity on occasion of death, as we are celebrating the death anniversary of our Samuel Hahnemann, sir. Today, this is my second session. In morning, I have conducted one expert session on materia medica in one college at Rajkot. So, it is I have selected this topic. Ebola is very much uh, contagious disease. The prevalence, the death rates are so much high, just like coronavirus. So it is very much important to talk about that. Recently, many researches are going on this particular topic. So in homeopathy also, we should start few things regarding this Ebola virus. So I have selected this topic, and I want to share my few things that I have selected for my presentation, sir. I can share my presentation or
Yes. You are co-host now. You can share it.
yes, okay.
Yes, it's visible. Everything fine. You can go
Yes,
ahead.
yes, sir. So, first of all, we should know about what is Ebola virus basically. So, this was the image here is given. This is a microscopic image to for detection of Ebola virus whenever any patient is getting any kind of infection. So, we can get this kind of image in investigation. So Ebola virus, it is also known as Ebola virus disease (EVD), or there is Ebola hemorrhagic fever is also one second terminology. EHF, it is termed as EHF. It is a zoonotic viral infection. Mostly it causes hemorrhagic fever in the humans and other animals or primates. It is caused by four of six known Ebola viruses. There are various categories available of virus. Out of four virus, one virus is very much prevalent. What are the symptoms? If we talk about the symptoms, the typically symptom starts after infection. The first symptoms start after initially after first day. It will usually take 1 or 2 days or 3 weeks after the infection. The incubation period we have found in the corona. Similarly, here is also patient is suffering from 1 to 14 days constantly, and if the patient is getting recovery up to 14 days, then there are chances of recovery more. And if the patient is passing more than 14 days, then it is very much difficult to recover from that. So because it is very highly contagious and spreading so much very much speedily in the patient. What are the first symptoms usually patient experiencing is first symptom is obviously fever, then comes the sore throat, muscle pain and headache. These all are symptoms are usually found like antiviral fever, which are not that much dangerous. So mostly what happens whenever patient is getting any kind of Ebola virus infection, they don't know. Firstly, they will ignore the sign and symptoms whatever present. They consider it as a normal fever, and so there is chances of dangerous starts from here only. And then the symptoms followed by vomiting, diarrhea, rash. Particularly rash is because of the there is a coagulation factor are working in our body. So in Ebola virus infection, there is a lack of blood clotting mechanism. The whole coagulation factor are not working properly. So because of that, there is a development of rashes. Then second effect is on the liver. So hepatic complaints starting, and then comes the renal dysfunction. So because of renal dysfunction, people will easily go into the shock, and at this time the patient will also starting bleeding internally and externally. Bleeding more occurs because the patient is uh, lost the whole coagulation profile, or there is also because of the hemorrhagic tendency, also patient are also start decreasing RBC count, and along with that there also decrease in HB. So because of that, the patient start bleeding internally and externally. Once the patient start bleeding internally and externally, इसके साथ ही उसके मतलब जो चांसेस ऑफ डेंजर है वो बढ़ जाता है. द फर्स्ट इबोला वायरस वाज फाउंड इन 1976, and in India mostly we have found between the 2030 and between 2016 the Ebola virus first case was discovered in India. इसके ऊपर मैंने एक लाइन लिखी है which is related with our homeopathy as well as it also caused it also suggests the severity कि लहू के आंसू से जो रोता है इंसान, इसके वार से कोई जंग नहीं जीत पाता इस खूंखार से. इबोला नाम है इस खौफनाक मंजर का, वो बस्तियां उजाड़ देता है बड़ी रफ्तार से. बिकॉज the mode of infection is so much critical and it is so much fast that sometimes we don't have any that much time to get the patient recover out of that. First few days pass like the patient has ignored the sign and symptoms. Now what are the causative factor? Ebola virus is mostly spread by the direct contact with the blood or any kind of body fluid which is affected the infected person, and it will pass to the another person who is not infected. Or also it is spread through the any kind of contaminated object. The first Ebola virus case is also it is said to be it is spread by the bats which are living in other countries. So bats are is a kind of animal which are having no any kind of sign and symptom presence because of the Ebola virus. They can work as a reservoir, and because of that, the Ebola also transmit through the human to animal. So cycle होती है. So length between, so it is passed through the blood or any kind of body fluid. Body fluid में in this body fluid we can also consider the semen. So if a patient is suffering with Ebola virus, so whenever the patient is recovered after Ebola virus infection, the patient should at least should use condoms during the sexual activity, because it is to be said that Ebola virus can survive in a any kind of body fluid, in that there is one semen also. So what happens if the person is recovered from Ebola virus and they are doing any kind of sexual activity without any kind of precaution, then there are chances to that that viral infection may also spread to the another person. What is the length of time between the exposure from the virus to the development of symptom? As it is said, the incubation period starts from the first day onwards. So between 2 days to 20 days, these are the incubation period, and usually patient will recover within 14 days if the vitality is good. But what happens when the patient is having severe symptoms available after cold, coryza, then each infection, then once the patient starting vomiting, diarrhea, and internal or external bleeding, then the patient is losing any kind of loss of vital fluid. So here patient will go into the shock. So after 14 days, if the patient is not recovered, then the death occurs because of this kind of situation, because patient will go in the shock, and because of the shock patient will go into the coma, or at this time the patient will also require intensive care unit therapy. If the patient is not getting in a proper time, then the death rates are so much high. So estimated mathematical calculation according, there is a 5% of cases are taking longer time than 21 days to develop the whole kind of symptom. Now what are the common signs and symptoms of available after the first day of infection? Mostly it starts with the headache, then comes the symptoms of sore throat related to respiratory symptom, pharynx, lungs, hiccup, sore throat, difficulty in breathing, difficulty in swallowing, then red eyes also. Then patient will start at systemic level, the patient will start also fever, then lack of appetite, internal bleeding, the patient will start. Then comes the heart affection, then comes the chest pain, then in stomach there is a presence of vomiting, diarrhea, so much of vomiting, so much of diarrhea that cause severe blood loss in a patient. Then patient is having the muscular weakness, that whatever we are feeling in the during the corona period, that kind of severe body ache pain is present here also. Then joint pain is also there. In intestine there is a presence of diarrhea, and rash development is there because of the patient is having internal bleeding with below the skin. These are the common signs and symptoms which are available at a corona patient. Now what are the diagnosis portion are available for the confirmation of Ebola patient? The first we are doing is the CBC count. In CBC count, usually we will find that the WBC counts are less, than low platelet count are present, and as I said that the blood coagulation factors are not working properly. So because of that, patient is having lack of RBC. So low RBC is present. Along with that, there is also depletion of normal HP count in patients. So these are the CBD findings which we can available with which are available with the Ebola virus patient. In liver, it increased the AST and ALT levels, and VTCT, that is blood bleeding time and clotting time, it will also increase because the patient is having low platelet count. So coagulation factor will not work, and because of low platelet count, the patient is having high chance of hemorrhage are present. Next confirmation test is usually we are doing RT-PCR, that we are also doing in during the corona period. So it is a confirmatory test to confirm the Ebola virus infection. Mostly other pathies are giving antiviral medicine. Vaccines are also available. We have vaccines available, but all the patients are not getting that kind of benefits that patient actually should get. And in a emergency condition, patient is also required ICU support. So this was the part regarding this was the part regarding the in general overall management. Then this is an important part which is homeopathic related. So Ebola virus and homeopathy, what homeopathy can help, usually these all are the medicine I have selected, those medicine which covers the hemorrhagic fever. In dengue also there is a dengue hemorrhagic fever. So in Ebola virus also there is hemorrhagic fever. So whatever medicine I have selected, in that the common symptoms of Ebola that which I have stated here, these all symptoms are present. And what are the differentiating symptoms available to the patient? Those patient symptoms which we can get the individuality, and when we can select the medicine. Right now we have no Ebola virus patient in India particularly. So whatever the discussion we are doing, that is that which kind of medicine may help to the patient. I have created one mnemonic on that, EBOLA and other remedies group. These are the 30 medicines group available. So we are differentiating one by one. The first medicine is Elaps coriolanus. The first of all, this remedy is prepared from the snake venom. So whenever the snake venom is there, the patient is having a burning sensation first is present, because the patient is belong to the animal kingdom, and in animal kingdom the symptoms medicine there is a burning sensation is present. Then in animal kingdom, snake especially, there is a discharge is a characteristic are very much black or very much dark or brownish color or blackish color discharge are also present in elapse. So black color discharge, the elapse patient are usually having aggravation from cold things. If they eat any kind of cold drinks, if they eat or drink any kind of cold food or drinks, then patient is getting aggravated. And the typical desire, the patient is having desire for buttermilk, especially the when the buttermilk is sweet. It is a one of the characteristic symptom for the elapse. Then liquid, what happens in a snake animal, usually there is a sensation of something is stuck in a throat. So whenever patient is eating anything or whenever patient is drinking anything, the patient is having sensation like something is stuck in a throat. So it's stuck, it the liquid gets arrested for the some time, and after that it will fall down heavily to the stomach. This was a characteristic symptom we can found in a Ebola virus patient. Also, there is a, as it is prepared from the snake Ophidia group, the patient is having fear of rain. So right now the monsoon season is going on. So if the patient is having fear of rain and fear of apoplexy is present, then we can think of Elaps coriolanus remedy. Next remedy is Echinacea angustifolia, as it is prepared from the plant group. Echinacea is usually indicated in a cases where there is a blood poisoning is present. Second one is there is a whenever there is a kind of septic condition is present in a patient. So whenever we give the Echinacea remedy, the patient is having septic state, the tiredness state, it will improving very much. Then the patient characteristic symptom for the Echinacea angustifolia is there is patient is having periodical flushing of the face. Sometimes patient is having flushing, and at a particular moment in a day, the patient is having plethora or flushing on the face, and another time there is no flushing at all. So if we want to give echinacea, then these are the characteristic symptoms which we can differentiate. Then another remedy is Baptisia tinctoria, is again belongs to the plant, and Baptisia tinctoria, it is a very good remedy. We know that it is a very good remedy for the fever, especially typhoid fever. Then what are the indication for uh, Ebola virus? So patient is having low grade fever. Fever is there, but temperature is not much there. And Baptisia is a very good remedy for one of the trials of offensiveness. So whatever the discharges are present with the Ebola virus patient, either it may be vomiting, either it will be diarrhea, either it will be hemorrhage. Then the patient is all the discharges are so much offensive in nature. Then patient is having a critical feeling that the patient is divided in two parts. So whatever the part, either is patient is divided or the part are dividing, the patient is try to collect again. So this was a feeling that is individual to this medicine. What are the parts are missing, or what are the parts are double, or what are the parts are divided, the patient will try to collect those all. So that is a indication for the Baptisia tinctoria. Then next medicine is belladonna. Belladonna, as we know, it is a acute remedy. The pain of the belladonna patient is so much coming acutely, coming violent, sudden, and going like suddenness. Another characteristic symptom is belladonna is very good remedy for inflammation. So because of Ebola virus infection, if the patient is getting any kind of inflammation, particularly in a region of the liver or particularly in a region of the kidneys, then belladonna is indicated. Another characteristic symptom we know is redness all over the body. The patient is beautiful. We always says that belladonna is mostly indicated in a patient who are beautiful, especially the female ones. Along with that, there is a redness of red face is present. Along with that, there is a heat is present. Whenever there is belladonna, there is a heat is present. There is a presence of congestion. Then there is a violent symptom. It is also indicated remedy when the hemorrhage hemorrhage occurs very much acutely, sudden and violent onset, and bleeding is not stopped. So, and then we can select the belladonna remedy. Another remedy is Brownia alba. So, what are the indication? We know the Brownia is again from the plant remedy, and Brownia is a good remedy for liver affection. So, whenever the liver affection is present, along with that, there is a tendency to hemorrhage. Whenever there is a bryonia, we will remember that there is a dryness is present all over the mucous membrane, then serous membrane, everything will become the dry. The patient who is having the thirst is characteristic. We can differentiate from another remedies like thirst for large quantity, cold water, and a longer interval. And when the patient is having the stomach symptom, the patient is having so much desire to eat so many things. It is reflected as a gourmand. The medicine symptom is written as a gourmand. So patient is wants to eat so many things at a time, but there is a in GID there is a process of indigestion is going on, and whenever patient is getting the Ebola virus infection, he will constantly worried about their work, their business. The constitution of the Brownia patient is dark complexion. Mostly patients are we can see, and patients are constantly worried about their business. They will talk about wants to go home even though they are not at home. The typical modality Brownia is having that movements aggravate. Particularly, there is a summer aggravation is present. So whenever the season is summer and if any kind of patient is having this kind of symptom, then we can think of Brownia. Then comes the oxalic acid. Oxalic acid, as it is prepared from the acid, so it belongs to oxalic acid group. And all the acids is having a kind of debility is present in them. What is the difference in oxalic acid from other acid? Then a pain. Whatever the pains are present in a Kalika patient, the pains in a spot, the patient can describe the pain that it can be covered by a tip of the finger. That kind of pain is also found in oxalic acid. Along with that, there is a presence of periodicity. So, whenever the patient is having periodicity in a symptom of Ebola virus, along with that, there is a pain that can be covered by a tip of finger. And the remedy is Kali Harp. So, it is oxalic acid. Then comes the lachesis mutus. Again, it is from the SAC remedy. So, elapse, lachesis, and in other group, we have Crotellus horridus and we have Crotellus cascavella. So, what happens in a lachesis patient? We know that lachesis is a left-sided drug. Particularly, the symptoms start from the left and usually go to the right. Lachesis is prepared from the snake. So, whatever the symptoms are, snake group are present. That is jealousy, suspicion. The patient is so much religious, so much talkative, the sexuality is so much high. Because what happens whenever patient is coming from the animal kingdom, and particularly it is from the lachesis, then in pathogenesis the lachesis is having energy which is suppressed, especially at that energy needs any kind of outlet to come out from the body. And in legacy patient, usually the energy is suppressed because of there is a suppression of sexual desire. So whenever the patient is not getting any kind of outlet, the energy will find another outlet in the body. So if the patient is doing any kind of sexuality, then the legacy patient energy will be released. But if it is not happens, then the patient will go in the other channel. A patient is having another kind of disease. So legacy is having a left-sided affinity, then sexuality, then jealousy, suspicious nature, and also there is a presence of black color discharge are present because it is prepared from the snack. Also, there is a good remedy for burning. Also, it is a good remedy for hemorrhage. Hemorrhage, especially there is a bleeding, which is especially dark black blood is found. Also, one of the characteristic of the lachesis remedy that we know on the physical aspect, that black colored tongue is present. The tip of the tongue, it is actually like a snake. So if we find this kind of symptom, then lachesis mucus is indicate. Then next remedy is the leptandra, and it is a very good remedy for liver first thing. So whenever because of the Ebola virus infection, the liver get affection, we can think of leptandra. In leptandra, there is a presence of tar-like stool. Whatever the discharge, stool is there or vomiting is there, it is a typically looks like a tar of the roads, that black like stool. Also, it is a very good remedy for malaria kind of fever. Also, there is a presence of portal congestion. So patient is having any kind of varicosity, then any kind of liver affection. Along with that, there is a tar-like discharge. That it is an indication of leptandra virginica. Then comes the next remedy is alumina. In alumina patient, there is a chronic state of poisoning is present because patient is having patient is using long-term using of history of aluminum utensils. So because of that, the patient is starting the chronic state of aluminum poisoning, and alumina is a good remedy. As we have seen brahnia, in brahnia there is also dryness is present. In alumina also there is presence of dryness. Along with dryness, there is a patient is having very much little thirst. Along with that, one characteristic symptom mental level, the patient will forget everything. So patient will forget his or her name. They will forget any kind of name of famous street or their home address, everything. The last state will that we will find it alumina patient is who am I. The patient don't know who they are and everything. Another particular physical level, there is a presence of leukorrhea that is in a female patient, which is so much profuse, so much acrid, so much yellow is that running down to the hills. That is a indication of the alumina. Along with that, one potato disagree state is also found in alumina. So if we find this kind of totality, then we can think of alumina remedy. Next remedy is argentum nitricum. We know it is belong to the mineral group. So in argentum nitricum, there is a presence of yellowish and greenish color discharge. So Ebola virus infection, either vomiting is there or the stool is there, diarrhea is there. Usually it is greenish or yellowish in nature. What happens in a argentum nitricum patient, because of the nitrate part, we cannot control the patient. There is a escapism mechanism is present in a argentum nitricum. Argentum nitricum is very good remedy for exam, fears, phobias. The patient cannot perform anything with the confidence. So argentum nitricum, it is very good remedy for fears. Then also there is a fear of falling from the heights, fear of the close place. These all are symptoms. We can think of the argentum nitricum because the patient is having also there is presence of also symptoms like nausea, vomiting, which are yellowish and greenish in color. Along with that, there is related to mind. So exam fear or fear from the falling from the heights. Along with that, the patient is having fear like close place. They cannot bear the close or any kind of place like that. Another remedy is arnica. Arnica we know is a good remedy for injury itself. It is belongs to the injury group. The typical symptom which is arnica is having the sore limb, bruised feeling. Along with that, arnica is a very good remedy for fear. Uh, most of the fear which is typically includes the fear of touch. The arnica patient cannot bear any kind of touch. Along with that, there is a internal bleeding is present in arnica. In arnica, usually patient is having a internal bleeding because of any kind of blunt injury. But in ebola virus condition also, patient is having internal bleeding, so we can prevent them. Agoraphobia, that is a fear of the any kind of space. So agoraphobia is present in arnica. Along with that, there is ailments from soap. So whenever patient is from arnica, then there is a ailments from soap, especially the hemorrhage. After hemorrhage, there is so much blood loss is there, and patient is going to the coma. And then lastly, there is a presence of soap. Then we can think of arnica montana. Then next remedy comes is arsenicum album. As we know, arsenicum album is firstly it is a poisonous remedy. So uh, it is a deadly poison, especially. So arsenic album is patient is having Ebola virus symptom. There is also periodicity is present that the patient is having aggravation with especially midday and midnight. That is 12 to 2 a.m. or p.m. That is a time modality. Then next comes the arsenic is having the thirst typical, which is characteristic. That is a small quantity at a small interval. When the patient is in a acute state, when the patient going in a chronic state, there is a no thirst at all. Then patient is having cadaverous odor, offensiveness odor is present, and we can think of arsenic carboways. These are the those medicine we can prescribe to the patient when the patient is in a last stage of ebola virus infection. Because in arsenic carboways, and also there is a one medicine Veltramab, the patient is having hippocratic phase. So whenever the hippocratic phase is present, the patient will surely go into the death. So these are the medicine which can cover this kind of modalities. So burning is present along with that cadaverous odor. The discharges of the arsenic patient are blackish or brownish or dark brown in color. Discharges are available. Along with that, there is a thirst. So these are the indication for the arsenicum album. Then next remedy comes is a carbo waste, as it is we know it is prepared from the vegetable charcoal. So what are the characteristic of charcoal? It is present in a medicine itself. So patient is slow, the patient is sluggish, the patient are very much fatty, they are so much lazy, having bluish purple discoloration is present over the skin. Then also there is a because of the so much loss of vital fluid, patient is having a low condition. The patient is having desire for the fanning. So as we are having the charcoal and if we were to burn it, then we have to fan from the very close distance. If we are fanning from the far distance, then the coal will not whole will not burn. So these are the symptoms which are also present in a patient. So carbohydrates having the desire for the fanning for the near distance. Also there is aversion to darkness, because whenever we are burning any kind of charcoal, it creates any kind of light. So patient is having, there is a aversion to darkness is present. Then also there is a fear of course. Then patient is having a death pale face. And patient carbohydrates patient we can indicate it in those patients who are not actually recover or never recover from their chronic any kind of chronic disease. We can think of carbohydrates in that patient. Hahnemann is sir is when they are practicing, Hahnemann sir has given one patient who is almost about to die, and after a prescription of carbohydrates, I don't remember the potency what he has prescribed, but after given the medicine, the patient is recovered. The next remedy is China sulfuricum. Chininum sulfuricum is also there. In China prescription, there is also presence of periodicity. Then there is a rapid destruction of RBC. So whenever the patient is going in an internal hemorrhage, there is a, if we find that there is a rapid destruction of RBC, platelet, WBC, along with that there is rapid destruction of hemoglobin count, then we can think of China sulfuricum. Also there is a presence of periodicity, hemoglobin count will be low, and there is a presence of leukocytosis in the CBC count. Then next two remedies are belongs to the snack family, the Crotellus cascavella and Crotellus horridus. Both the remedies having the snack kingdom. So Crotellus cascavella is patient is having the fear of death. Also there is a patient is getting the dreams of death. Also there is a sensation of paralysis. So these three things are present in a Crotellus cascavella. What happens in a Crotellus horridus? Crotellus horridus is again belongs to the snack remedy. So there is a burning is present. So there is a hemorrhage is present. In Crotellus horridus, there is a decrease in a blood coagulation profile. From this group, there is a elapse, then belladonna, echinacea, then Crotellus carbovage, Crotellus cascavella, horridus, hememalis, and especially phosphorus. These all are remedies having decrease in a blood coagulation level. So coagulation time will increase. The patient is having more chances to develop the hemorrhage. The character of the blood will be dark blood. It will also getting decomposed. So dark blood will now convert into the black color. Then it is a good remedy to act as a sedative. And also patient is loquacious. Patient is so much talkative. Patient is having also tendency to escape. That is a characteristic of Crotellus. Also there is a illusion or feeling that patient's cerebral patient is going under cerebral decay. That is a characteristic of Crotellus horridus. Next remedy is Perum metallicum. As it is prepared from the metal group, it belongs to the metal family. We know the Perum metallicum is again a good remedy for anemia. So because of Ebola virus infection, if the patient is going to the any kind of anemic state, then we can also think of anemia. The patient is having paleness is present in a patient. Then in Perum metallicum, there is also characteristic headache, which is very similar to Natrum muriaticum. The patient is having feeling like there is a throbbing pain, the hammering pain in the headache, that the hammers are thousands of hammer knocks the brain. That is a characteristic present in a Natrum mute. That is a similar kind of pain is available in a Perum metallicum. Also there is a headache. It is aggravated. Parametallicum patient is usually aggravated by any kind of opposition, because it is prepared from the metal itself. So whenever the patient we will find the patient is having aggravation from any kind of opposition. The patient will cannot bear any kind of opposition. So aversion to opposition is again a parametallic indication. Then again there is a oversensitiveness is present, the redness is present. When patient is healthy, the patient is having a very much red and fair face is present. So these are the parametallicum indication. Then the next remedy comes is MMLis virginica. It is a very good remedy. It can be used in acute condition whenever there is a hemorrhage. Hemorrhage is particularly when it is acute in nature. Aconite is nicknamed as the aconite of capillovenous system. So whenever there is a hemorrhage, we want to stop it acutely. Then we can think of hemamalis virginica and hemamalis also. There is presence of varicosity, then presence of hemorrhage, and patient in psychological state of hemamalis, the patient wants any patient will not tolerate any kind of disrespect with them. So want of respect is again a psychological indication to selection of the Hemamalis virginica. The next remedy is Kalium carbonicum. Kalicarb we know is it very much famous and polycrase remedy. It is belongs to the potassium group. So what are the indication to prescribe the kali carb? Again, the whatever oxalic acid symptom pain, that pain can be covered by the tip of the finger. That is also available in a kali carb. Then kali carb patient are so much there is a symptom start that backcase perspiration and weakness we will usually find in a kalika patient. Then kalika patient are so much worried and tense about regarding their family members, especially their typical Indian parents who are so much worried about their parents. Those are the kalika patients. Then the patient are so much rules bound, they are so much duty bound, they will cannot do anything that is out of the box. We can say kalika patients are they are the main of their words. They, whatever they say that they will do, they will almost do that. So that are the kind of very few characteristic to prescribe the kalika. Then next remedy comes, that is melalotus alba. Melalotus alba is also having any kind of hemorrhage. Then also there is presence of congestion. Also melalotus alba is also good remedy for spasm. Spasm especially occurs in a infant. So it is a infant spasm. The patient wants to run away and hiding tendency which are present in a shy children. So patient, if the patient wants to run away and hiding tendency, then pain and debility are also found in a mellitus patient. It occurs because of so much blood loss is present. Next remedy is Millifolium officinale. It is also known as Millifolium. It is also having the any kind of hemorrhage, then fever. The patient is having high grade of fever. Along with that, there is a presence of hemorrhage. Along with that, the patient is having a typical characteristic, that is a vertigo. Whenever the patient is moving slowly, then the vertigo starts. So fever with hemorrhage. Along with that, patient is having vertigo by slow movement. So it is an indication of mellipolium. Next remedy comes the muriatic and nitric acid and phosphoric acid. These all three are belongs to the acid group. So debility will be there. There is severe prostration is there. Then what is the characteristic in a muriatic acid? That patient is having low kind of fever. The patient is having septic state. The prostration is present. What is the symptoms? Unique symptom found in a muriatic acid, that the patient is having aggravation from any kind of silence. The patient cannot tolerate silent situation. The next remedy is nitric acid. Again, nitric acid is belongs to acid group, so debility and prostration will be there. There is also presence of hemorrhage. The discharges of nitric acid are burning, acrid in nature. There is also presence of blood, which is so much dark and then kind of then there is a characteristic urine. The patient is having a discharge of urine which is typically smell like horse urine, and the patient is having affinity when the skin and mucous membrane are matched, or whenever there is a skin folds are available, the nitric acid is having good affinity. Along with that, patient is having rashes and patches appear on the skin, then it is an indication of nitric acid. And the next remedy is phosphoric acid. There is a element phosphorus is present. Along with that, there is a acid. So phosphorus is having debility is present, the patient will start from the mental debility first, and then the patient is having physical debility. Then it is indication of phosphoric acid. Along with that, there is a presence of rapid growth. The patient is growing so much fast. So we can say the milestone, if we talk about the milestone in phosphoric acid patient, we will say the patient is having developed the puberty very much at a very earlier age. The patient is so much having weak memory, they are so much listless, they cannot think, there are so much confusion is present in phosphoric acid patient. That also there is a presence of ailments. If we talk about the ailments, the phosphoric acid patients are having ailments from the any kind of shock and any kind of grief, psychological grief, along with shock because of the hemorrhage, and phosphoric acid is present. Then next comes the phosphorus remedy. The phosphorus is again the is having the burning. The burning is present at the internal part of the body. That is one of the indication for phosphorus. Then next indication is the person is so much constitution. If we talk about the constitution, the phosphorus patient are usually tall, slender patient having so much narrow chest. The miasm, if we talk, the tubercular miasm is patient. The hair of the patient are reddish in color. So along with that, there is a psychological state. The patient is so much. Patient is having magnetic desire. The patient wants to. Patient wants to. What we can say. Patient wants to impress everybody. They are so much talkative. Whenever they go at a new place, they will impress everyone within short time. Another characteristic indication for phosphorus is hemorrhage, then bleeding internal or external. Then also phosphorus is having whenever there is a coagulation profile is at a problem, or the blood coagulation is not working properly, the patient will start blood clotting at various places. Then psychological patient, phosphorus patient are so much naive. What we can say, naive, they are so much down to earth, they are so much polite. There is a desire for light is present, is also phosphorus. Also sometimes also phosphorus is by their behavior, they will impress everybody. So there is a impressing desire, that is we can correlate with the magnetic desire, desire to please everybody. Then next remedy comes is rust strokes. In rust strokes, there is it is a good remedy for restlessness, mentally restless, physically restless, also typical modality. And rust stroke is having aggravation from any kind of river bathing or that kind of situation. Then one characteristic symptom for rust strokes is red triangular tip of the tongue which is present. If we talk about another symptom, key aspect at the psychological level, then rust strokes patient is having a fear of being poisoned. So patient thinks that somebody will give me the poison and I will going to die soon. So that's a characteristic. So symptom for the rust strokes. Next remedy is the staphysagria. In staphysagria, what happens again? It is a prepared from the plant. So in staphysagria, there is two things, where is a suppression and repression, which both are present in a patient. Also, patient are having issues with the anger. Patient is so much getting so much angry at particular time. Then there is also elements from being any kind of insult. Patient, whenever the patient is feeling any kind of injustice in their life, whenever the patient is feeling any kind of insult regarding their image, they will not tolerate, they will fight towards the authority. In staphysagria patient also there is a presence whenever the patient is having any kind of punishment. If the we give any kind of punishment, so whenever patient will go home, they will surely suffer with fever with them. Also, there is a characteristic indication to prescribe Cephasagria, that whenever they are getting the fever, during the fever, the patient is having a tendency, especially they wants to eat any kind of spicy food or that kind of thing, because spicy things again they it gives any kind of stimulant to the patient. The next remedy also comes the belongs to the acid group, that is sulfuric acid, and another remedy is sulfur. What is the difference between sulfuric acid? The sulfuric acid patients are usually having debility. having hemorrhage, burning tendency is present, and in sulfur these all symptoms are also present. And in sulfur there is a constituent, there is a, because of one constituent, sulfur is having the tendency of astringent. So whenever the astringent is there, it is related with the blood coagulation. So whenever the patient is suffering with any kind of blood coagulation disorder, we can think of sulfur. Constitutionally, sulfur patients are, as we know, that they are so much dirty in nature, they are so much there's so much dirty, filthy body. They are never washed. They are so much untidy, uncured. Just like a carbo-based patient who are never get recover from their chronic illness which are previously present. The discharges of the sulfur are so much dirty, so much filthy in nature. The sulfur patient usually we will find in two category. One patient sulfur is so much intelligent, who is having a fiery person, who are doing so much thing, and they are so much intelligent in nature. Egoistic nature is there, then selfish nature is also present in sulfur. And at another level, sulfur patient will completely lost their memory. So it is a very good remedy for both aspect. They are so much intelligent. At another level, there is a weakness of memory. Then we know the sulfur is having a aversion to bath, which is present. Also, patient cannot tolerate the standing posture. So if the symptoms aggravate in thin condition, then we can think of sulfur. And the last remedy is terebinthina oleum. This is the last remedy. In terebinthina, there is a presence of hemorrhage. Along with that, there is a bend-like sensation is present in a patient, and the patient feels like in the patient feels like my voice is changed. It is not like that what is present previously. The patient is having sensation that my voice is changed. Along with that, there is a feeling of bandage, and along with that, there is a presence of hemorrhage. So that are the indication to prescribe terebinthina. So as per my reading and research, I have selected these remedies for particularly what I feel elapsed, then echinacea, then snake group, lachesis is there, carbo vegetabilis is there, then comes the crotellus, then lachesis, then hememalis, then comes the phosphoric acid. These are the remedies which typically we can typically, we can correlate with the symptomatology of the Ebola virus, which are present here. So, whenever patient come, we can think of this remedy and hopefully we will try that patient will get recover, because as we have seen that we are not treating any kind of disease, we are improving, considering the patient as a whole, and we are prescribing the medicine for the patient as a whole. So totality of symptom and general symptoms will help in a selection of remedy. So whatever the remedies are present, we have used arsenicum album in coronavirus so much. So these are the remedies that can help in a coronavirus whenever the coronavirus is present in a patient. And lastly, I would like to conclude my session with the lines of Hahnemann, that it is written as a Solomon Declaration in Organon of Medicine. These lines are favorite, that I have marked as a red line, that those who will follow my example will be able as I am. As we know, we whatever we do in a field of homeopathy, we can be never equal to the Hanuman sir, whatever they have done throughout their life. So it is so at the last he said that I have not led you lane. My conscience is clear. But as a homeopath, we should always do research activity in our field, and we should do many more things that will help to the patient as well. Along with that, we have to do research in this coronavirus. Recently, CCRH has also started this kind of thing, and this thing will help ideally. So, lastly, I would like to conclude with this line of the Hanuman. So, thank you, sir, for giving me such opportunity to say my few lines regarding the Ebola virus infection and what it may help in a this kind of condition. Thank you, sir.
Exactly. This is what we are expecting from a homeopath, that kindly, this is the need of the hour, because we as homeopaths we used to say that we have a solution, what would be the disease, that we treat the patient and not the disease and the diseased person. So whether it be a case of viral fever, cold, whether chicken pox, mumps, measles, COVID, or even Ebola. I think we have a solution. We have the right methodology because we treat the patient by
No, sir. Thank you.
individualization, and almost all medicines were there in our kitty. We can in our kitty, and we have to choose the right medicine as per the
Yes.
patient and not by the name of the disease. That is what the basic difference between homeopathy and allopathy. That's the reason why we used to say that homeopathy has a medicine for viral fever, all type of viral fevers. That's why at the time of COVID, people used to say that how we have no medicine for the treatment of this COVID, but we as homeopaths used to say that we have the medicine. If we get the patient, we are ready to treat and we will cure the patient as
Yes.
per. And we have done it and we have proved that world that homeopathy is a wonderful system of medicine that can cure all kind of viral diseases and other diseases also, whether it be acute or chronic. We can try our best to bring the humanity back to health in the shortest possible time. All the medicines you described were really useful, and most of the doctors used to take these remedies because most people believe that it is a condition where the brain is affected and the blood system is being damaged, and how will you treat with your medicines? Yes, the medicines from the uh, Ophelia group really works wonderfully in those cases. And not only that, in symptomatically treatment also we can do wonders. Congratulations to Dr. Ramod for a thrilling session and particularly on a day where Dr. Heinemann left from this world, and we used to celebrate in a different way that the anniversaries is actually uh, it is a big tribute to Dr. Heinemann's invention here, and we are lucky to have such a wonderful person in Dr. RAXITKUMAR here in paying homage to our master once again.
Thank you, sir. Thank you so much.
Yes, those who interested to talk with Dr. Ramoth, please raise. I am inviting Dr. Manoj first and then Dr. Vibhu Kumar Pandey. Sir,
Yes, thank you, Dr. Tanesh, and congratulations to Rakshit Samath. Nice presentation being a material medical teacher. Yes, I think you are very successful in connecting a lot of medicines with ease. Described all medicines, and you are successful in differentiating each and every medicine. That's another thing. So that's the most important thing. Nice presentation, and people like you, young, talented, are real assets of homeopathy in the coming days. You will be able to carry out because the number of viral diseases are increasing, and the medical world is trying all firing all cylinders, but not successful. So thank you for participating, and come again with your students in this the part two. Thank you.
Thank you, sir.
yes, Pandey sir, you can speak now.
Sir, Dr. Akhit, he is a good teacher in Medica in our college, and also he is mentoring third year class. And really, I appreciate today's presentation within a short time. So he emphasized the symptoms, symptomatology, which is the outcome. Actually, as you told, that we are not treating the disease, we are treating the patient. That may be Ebola, that may be rhinovirus, that may be flu, whatever it may be. So we should not consider the material becomes what is called material cause of the disease. We should consider the symptomatology. Considering the symptomatology, we have to frame out the portrait of the disease, and according to the portrait, we have to select the medicine what Dr. Rakhit has justified today. So he has described near about 60 medicines. What I think. So all the medicines in different approach. For example, as you said, Ophidia group of medicine. They are very effective medicine for hemorrhagic he has also emphasized the Kali group. So, and the symptoms and signs within short period, the charismatic symptom of bryonia, charismatic symptom of carbovage. So, if you collect the charismatic symptoms, and according to the charismatic symptom, if you form the frame out the totality and select the medicine, then definitely will be success, irrespective of the virus, irrespective of bacteria, whatever it may be. Because Hahnemann has already written in 11 aphorism that these are the material cause of the disease. So material cause of the disease, they can propagate the disease, but they cannot produce the disease. So if we consider the cause, the prima causa morbi, what is called primary cause of the disease, and accordingly the derangement which is caused by this primary cause in the system. So if we collect all those symptoms and organize them in systematic manner, with a logical manner, with proper placement, the picture which is formed, that is the real patient. So as the picture is formed, the medicine which is very similar to that picture, if you prescribe with proper dose and potency and repetition, definitely will be success. So in homeopathy there is a solution for Ebola treatment, and you can prevent also. Of course, Ebola has not spread in India. It has been spread in African countries, but still then we need to analyze. We need to think about it. So I am very much thankful to Dr. Rakesh sir, as he
Thank
thought
you, sir.
about the Ebola virus, though it has not spread in India. So every homeopath should think about our scope, and we are having a great scope. So we should go ahead accordingly. And in the Reverence Day of Hahnemann, Dr. Rakhit has justified his presentation. Thank you very much.
Yes, thank you,
Thank
sir.
you, sir.
And now it's up to our Vice President, Dr. Shaji Kuriat. Please unmute, Doctor.
Okay.
There is some network problem with you. Yes, Doctor, your network is weak.
Then conclude, Dr. Ganesh.
Yes, Dr. Ramavat sir, you can say the vote of thanks to the session.
Thank you, Dr. Dhanesh ji and Dr. Panda Sahib. Namaskar, Manoj ji, everyone. Namaskar and congratulations, Dr. Rakshit Ramavat. Very nice, excellent
Thank you so
session.
much, sir. Thank you, sir.
Ebola virus. Very good. Describe the Ebola virus, hemorrhagic remedy, Opedia group, and very good describe the Ebola virus and homeopathic aspect. E. elapse and B. baptisia, belladonna perennia, and O. oxalic, L. Lycasis, Lependra, Elimina. So very good. So very nice presentation. And behalf of IFPH whole team, very thanks. Thank you again presentation.
Thank you so much, sir.
Thank you, Dr. Ramavat sir, Dr. Vibhu Prasad Pandey, sir, Dr. Manoj, and those who attend the English session. And a big thanks to Dr. Raxit Ramavat for this excellent session on Ebola and homeopathy.
Thank
And
you.
tomorrow we will have a session from another doctor from the same college, and that is Dr. Ashmita Rathod, and she will be talking about miasmatic bacteria medica. So
Yes,
hope all of you will join tomorrow at the same time. Thank you all.
sure. Thank you, sir. Thank you.
Over to Dr. Manoj tomorrow in the Malayalam session.